that patients face while searching for a matching donor? Of course, we see that we get a lot of search requests in our own registry, but not that we have every donor to cater that patient.
To be honest, the real life challenges that we face is not getting a match, but trying to contact that voluntary donor after registration to get him on or her on board. So now, compared to what the number of volunteers that we had years ago, what we have now has significantly, of course, increased. From that data, finding a match donor is also not as challenging as it used to be earlier, purely because we have so many more numbers of volunteers available now or registered. But I think the biggest challenge is getting those donors convinced and getting them on board.
So that's precisely what we face every day. So some people believe that a family member will always be the best and only match for a transplant. Is that right or is that accurate?
Everything depends on your HLA matching. That's not blood grouping, it is different. These are the markers or the proteins which are present on your cells and which are unique to each individual. If we were to check individuals for the HLA, we would find a match 1 in 10,000. That is the rate of similarity, or that is the uniqueness of each individual. Having said that, within the family, within the siblings, because we take these HLAs half from the mother and half from the father, the siblings may end up having the similar composition or the same sequence of the HLA. Very rarely the parents can also have the similar sequence with the children, either of the parent I mean. But it is not, as long as the family member is fully matched, that family member becomes the most suitable match. But when the match is less than full matched or less than half matched, then one has to look for matched unrelated donors. Also, it depends on the condition for which we are transplanting.